Going to start from the beginning here. And now we have the US context, which I don't know if you can get to a more extreme deregulatory environment, but here we are. Listening to Peter and Norma, and I've been following what the HSE in the UK has been doing for some time, as well as the Canadian standard. And obviously in Europe, they're very far ahead in terms of psychosocial hazard management or prevention. The United States is not even in an embryonic phase, I think, in terms of work stress prevention strategies. Although I think you'll see that we've been making efforts within the realm of nonprofit kind of grassroots approaches, which is oftentimes what's left to the United States, worker-led approaches as well as academia-led approaches. So we're going to talk about that, and then we may have time at the end, I'm not sure, about the possibility for psychosocial risk regulation in the United States. Obviously, that's a long-term goal that we have. But we're in the very early stages, and honestly, with the political climate that we have and with the COVID situation, it's probably very, very far away. So I'm here. We're going to talk about the Healthy Work Campaign, which is a public health campaign that really is beginning to address the awareness and raising awareness about work stress and work stress prevention in the United States. So I'm here to represent my colleagues that are all working on this, along with Paul Landsbergis, who will talk in a moment.
So Marnie, yeah, we're not seeing your slides yet.
Oh, you're not? Oops, I can see them.
Did you share?
Let me try that again. Did.
Maybe you didn't.
Oh, you know what? I'm sorry, I did not. I put them up for me and did not share.
That's okay.
There we go. Sorry about that. Here we go. How about now?
Yes, it's
Okay,
good.
Good. All right. I just forgot the most important step. So, we have a work stress epidemic in the United States, like most of the other countries. We have data it comes out annually. We routinely see about a third of US adults saying they typically feel tense or stressed out during the workday. Self-reported stress. During COVID, we just recently had another APA Stress in America survey coming out over April and May, and it showed extremely high levels of stress right now for people dealing with COVID and the lockdowns. One statistic had 50% of parents reporting with children under 18 very high levels of stress just for managing the online learning during pandemic. So, I'm in that boat as well in terms of dealing with working at home, dealing with trying to take care of children who aren't in school. And that's just for us who are lucky enough to be able to work at home. Those out there in the field obviously have very high levels of stress from other issues, including exposure to the virus, our essential workers. Just in general, 55% of US adults in one survey reported in 2017 that they felt stressed just the day before, which is one of the highest rates among 143 countries in a recent World Gallup poll. We know a lot right now, and this is part of our intention in the Healthy Work Campaign, is to translate and try to make more broadly available the evidence of the health effects of these commonly measured work stresses, the Karasic's model on demands and control, effort-reward imbalance, all of these. There's a great deal of evidence on the impacts on cardiovascular disease, not just mental health, although we know that it has effects on in terms of burnout, depression. We also know that these kinds of work stressors have the impact on high blood pressure, hypertension, and cardiovascular disease, as well as injuries, musculoskeletal disorders, suicide risk, and also recent research on opioid abuse and substance abuse. Jeffrey Pfeffer, an economist at Stanford, recently published a book based on some reports. Some of you may have seen this data. It was an economic model where they looked at the major work stresses that we're familiar with, including unemployment and lack of health insurance. And they estimated about 120,000 deaths per year was associated with how the US companies manage workers, is how they concluded it. We think this is probably an underestimate when you take into account job strain and cardiovascular disease deaths and so forth. It also, obviously is very costly in terms of healthcare costs, and not to mention lost productive days, absenteeism, turnover, and so forth. So this was a recent article published by my colleague, Paul Landsbergis, with his colleagues, where they looked at the National Quality of Work Life surveys, which are administered every 4 years in the United States. And they were able to show a trending increase in job strain between 2002 and 2014. And we also know that work-family conflict and work hours are on the rise in the United States. Of course, going along with that, we are also seeing really problematic rates of increase in chronic diseases and mental health. Increasing poor mental health has been reported in some of the large behavioral and national health surveys in the US in the last from 2001 through 2012, and also increasingly poor health indicators in working age populations. We've seen really, substantial increases in suicide rates in the United States, especially among the working age populations, among those groups that have a high school education or less, among white Americans, that we think have been along with opioid overdoses, associated with a decrease in life expectancy in the last several years in the US. We're also seeing hypertension increasing among 45 to 64-year-old groups. And cardiovascular disease mortality, in fact, has been slightly on the increase among working age populations, which is a surprising outcome and something of concern, given that the rest of the world tends to be still on the decline. We've been hearing about countries that have work stress prevention policies, guidelines, standards, or legislation. Obviously, we know about the UK management standards, the national standard in Canada, the Japanese stress check program, and other countries that have legislation in place. The US currently has no guidelines regarding psychosocial work stress prevention or health work at a national level, or as part of any kind of regulatory framework. So we're very behind the curve. Now, we do have, as part of our National Institutes of Occupational Safety and Health, Peter mentioned the Total Worker Health approach, which was developed pretty much starting about 10, 15 years ago. It's a holistic approach. They really do focus on this idea of worker well-being. It's defined as policies, programs, and practices that integrate workplace safety and basically health promotion. So they've been very focused on, okay, let's bring together health protection with health promotion. There's been an uptick since the 1990s in use of wellness programs in the corporate world, focused again on individual behavioral change, sort of focusing on the individual being responsible for stress management, as Peter talked about, rather than primary prevention. But bringing those two things together, integrating health protection and health promotion, has created a synergistic effect where workers are more likely to participate in behavioral change, for example. But, from our point of view and our review of the total worker health literature, we do see that it tends to focus on the individual, on individual level, tertiary, secondary prevention and health promotion. Although recently, there has been some acknowledgement of risk factors related to work and the psychosocial environment that are contributing to chronic health problems that were previously considered unrelated to work. Although this is very new and it hasn't filtered down too much into the research arena, the centers of excellence that they fund are still tending to bring together health protection and health promotion and less evidence around a work organization change. So the Healthy Work Campaign, as I mentioned, is a grassroots initiative. It's sponsored by the Center for Social Epidemiology, which is a nonprofit center that I've been working for some years, along with the director, Peter Schnall, and Paul Landsbergis and others are involved. We have a very broad mission. This is sort of a big ideas campaign to reduce harmful work stresses and improve job quality and health in the US. We've initiated a website, healthywork.org, with a number of people's help. As you can see, we're affiliated with researchers at University of California, Irvine, where I am, as well as Paul, who's at SUNY Downstate, and many others have been involved in this project. We also have been eliciting partnerships with various organizations. The Ontario Health Clinics for Ontario Occupational Health Clinics for Ontario Workers have just agreed to a partnership, and we've included them on our partner page. And so we're looking forward to continue to work and spread the message about healthy work. And Dorothy, thank you for being so helpful. Dorothy Wigmore, who's on has been a great help in producing a lot of this material. So overall, the goals of the campaign are education, educating working people specifically. We want to broaden our focus and try and translate some of these ideas for working people to understand and take advantage of possible solutions that they can be involved with. Of course, assessment is a major part of dealing with and finding out about psychosocial hazards in the workplace, and we've been involved. I'll talk very briefly about the development of an assessment tool, the Healthy Work Survey, that we're going to make available online. The third goal is to equip workers and organizations with healthy work tools. So we really have been working hard on this because it's not just about identifying the hazards, identifying the problems in the workplace, but also, what are workplaces, labor organizations, workers do once we identify the problem. And I think that deserves a lot of attention and time. And Paul will talk about this in a moment, about what we're doing to offer people examples and tools for implementing workplace change. And then, of course, to inspire action, which is really a larger goal behind a public health campaign. Is really to spread the word about healthy work, thinking about it from a primary prevention standpoint specifically, rather than focusing on individual tools like stress management and wellness programs and so forth, which obviously are beneficial, but need to be taken into addressed in relationship to the primary work environment. So our goal 1 of healthy work education, I mentioned our website, healthywork.org. We've worked on a 11-minute video teaser, which took a lot of time and resources, called Working on Empty, where we start to present some of these ideas in a video format to reach as many people as we can. I hope you'll check it out. We've developed a Principles of Healthy Work guide, infographics. We obviously have social media that we're working on to create an audience and a following. And Medium articles where we kind of talk about some of these complex terms and ideas in a broader way. Our Principles of Healthy Work obviously emulate a lot of the other kinds of focused on these healthy work principles and some of these other standards that we've been seeing. So we have the physical environment, the psychosocial environment, and so on. So this is the Healthy Work Survey we've been developing in collaboration with Dr. Bong-Kee Choi and our other associates, including Paul and myself. And it's a short validated tool to assess work stresses for workers, unions, and employers. We intend it to be online and anonymous and free, and it really parallels what John and Okow have been doing with Stress Assess. When we saw that tool, we were extremely impressed and hope to emulate this in the United States as a tool that can be provided to organizations as well as to individuals. So currently we are featuring the Stress Assess as an offering on our website. These are the items. We're using them from the NIOSH Quality of Work Life Survey. That's a national survey, so we do have a national sample that we can refer to. And we also will be asking about certain health outcomes, as well as providing a report to individuals and to workplaces that outline what the major issues and problems are. So our healthy work tools, I'm going to introduce my colleague Paul, and he's going to talk to you about some of the work we've been doing here. We currently have 3 tools pages on our website where individuals can access tools for coping and for involvement in collective action. Tools for employers, including a business case, and also based on evidence-based organizational intervention studies, we're offering organizations and labor unions case studies, which Paul will talk about, to see what has worked and what best practices are in work organization studies, as well as at other levels, including collective bargaining that's been addressing primary prevention and work organization issues, as well as state legislation, since at the federal level we won't have much luck, but there has been state legislation and laws that have impacted workload, for example, and paid sick leave. So I'll turn it over to Paul now, and he will talk about these intervention case studies that we've been promoting.
Great, thank you, Marnie. Can everybody hear me?
Yes, we can hear you, Paul.
Great, so let me share my continuing slides here. It's a real pleasure to be part of this webinar with colleagues from 3 different countries. As Dr. Dobson was mentioning, we wanted to present on our website information about how to reduce sources of stress at work. What are people doing? We didn't want to do just another literature review. Many of us have done that, but rather we wanted to put together a toolkit in language that was understandable for the public, for labor, for management, on what is being done to reduce sources of stress. Some of our case studies that we've posted on the website, we now have a total of 28 case studies. Some describe research studies that have been conducted, but other case studies describe collective bargaining language or laws and regulations, which have rarely been studied for their impact, even though they're legally binding and have the potential to reduce sources of stress. Okay, so here is our Healthy Work Strategies page with the 3 different types of case studies posted. Let me go on to the first type, the workplace research studies. And I wanted to just provide an example of a case of a study. Yes?
If you run your slideshow, I think the slides might be bigger for people.
Okay, let me try to do that.
Okay. Great, thanks.
Okay, so our colleagues at Université de Laval in Quebec City conducted this action research study. They did surveys of employees at 2 different hospitals to measure work stressors, mental health issues. In one hospital, they did interviews, and they established in one hospital an intervention team of labor and management. They fed back the survey results to that team, and that team came up with a long list of specific sources of stress at work in that hospital, 56 actually, and they came up with proposed solutions for each one of those and attempted to carry those out over a period of time. Some examples included providing nurses with greater influence on staffing, training, and schedules, improving team communication and support, reducing delays in filling open staff positions. And I recommend reading the article because it is a great list in detail that they provide of the types of stressors that they try to reduce. And then finally, after 3 years, they conducted a survey again at this intervention hospital and the survey again at another hospital that did not have this primary intervention. And they found that in the intervention hospital, sources of work stressors were reduced, but there was no change in those in the control hospital. For some health issues, sleeping problems, psychological distress, no change in either hospital, but there was a significant decline in burnout among staff in the intervention hospital, and no change in burnout in the control hospital. So some evidence that this intervention was effective in improving workplace mental health. Another category of case studies on our website, reducing work stressors through union contracts. One of the ones that we've posted describes the new contract bargained last year by the Los Angeles Teachers Union. But rather than go into that one, I wanted to just provide a little detail about what they are doing now, what they and another group are doing now to try to deal with the stresses of trying to work in the context of the current epidemic. So, for example, the Los Angeles Teachers Union used their contract action teams from last year to push back against additional work being demanded of them by administrators, because in part they were already doing a lot of extra work developing online learning activities for their students and monitoring their progress. The University of Chicago Graduate Employees Union won a number of things in their contract bargain this spring to reduce financial insecurity and job insecurity occurring as a result of the epidemic. More paid sick leave, better health insurance coverage, more internships and assistantships for those students who had lost that work because of online classes, or international students who were not able to travel back home and are having to stay in the US over the summer. So if you hear of additional examples of contract language, regulations, other activities designed to reduce the stress people are facing in the current pandemic, we'd certainly be interested in summarizing those for the website. Finally, our third category, reducing work stressors through laws and regulations. One example was the activity of government labor inspectors in protecting workers' mental health in Quebec. Catherine Lapel helped us with this case study, and of course she presented on this topic in last week's webinar. So what I wanted to do is just present some information on another type of law, which is nurse staffing laws in various states in the US, laws that require minimum staffing levels of nurses in hospitals. The strongest such law is in California. Unfortunately, there's been some good research evaluating the impact of that California law. For example, this study showed that among nurses in California, there was a dramatic reduction in injury and illness rates following the passage of that law in 2004, and compared to very little change in nurse injury rates in other states in the US over that same time period. And in a 2006 survey conducted of nurses in California, New Jersey, and Pennsylvania, it showed, well, first clearly that California nurses had fewer patients per nurse that they were responsible for than in the other two states. And if we look at nurse workloads across all three states, more nurses per patients were associated with lower levels of nurse burnout, nurse dissatisfaction, and less verbal abuse by patients. So again, some good evidence that improving nurse staffing in hospitals can reduce stress, reduce nurses' ill health, and of course also improve patients' health. As the previous speakers mentioned, there's many policies, guidelines, or standards in various countries, but how can we best evaluate them to see which ones are effective, how well they're working? One way is by looking at a survey that has been done in Europe across 31 European countries, same survey questions, where they measured to what extent are employers reducing sources of stress at work? To what extent are employees involved in those job stress reduction efforts? Those questions were called together psychosocial safety climate. And also in those surveys, they asked workers their self-reported health. Is your health excellent, good, fair, poor? And we can see that countries that had better psychosocial safety climate also had better worker health. In addition, in this study, they were able to look at another intervention, which is the proportion of the workforce in those countries that are members of unions, union density. The size of these circles are proportional to the proportion of the workforce that are members of unions. And as you can see here, countries such as the Scandinavian countries that tend to have a higher proportion of workers in unions had better worker self-reported health and better psychosocial safety climate. So hopefully we can do more research on comparing countries and comparing states and looking at what practices are effective. In our case studies, which we hope you'll look at on our website, we've included details about how the research studies were conducted, how the contracts were bargained, how laws and regulations were passed. People organized, they advocated, they worked hard to pass these. And so that's part of our message. In addition to whatever you may be able to do in your own workplace, you're not alone. You can also get involved in various campaigns across different workplaces and reduce stress by taking action. We look forward to hearing suggestions from you for new case studies that we can develop. And let's all work together to evaluate the impact of these various types of interventions, primary interventions. So let me turn it back for the last slide here to Marnie Dobson to wrap up our efforts.
People to support the Healthy Work campaign. Can you hear me?
Yes.
I can hear you.
Right.
Yeah.
Great. So we have ways of supporting the idea of healthy work. We created an agenda that can be downloaded around what people could do in terms of spreading a message about the importance of changing the culture of work, changing the organization of work, strengthening workers' voices, and supporting the enforcement of existing regulations and expanding them, at least in the US, to include healthy work or psychosocial hazard reduction. So please check out our website. We're, our partners in Ontario now we're going to work together to promote some of these ideas online and through social media. We just published an article today about work-family stress, work-family balance in the time of COVID on our medium.com website. So you can check that out. It just came out today. So thank you everybody for your time.
Thank you, Marnie and Paul. That's very interesting and a tremendous amount of work. It's funny, we were talking about OC disease this morning and how much effort all this work is, and that's a lot of effort and a lot of content that you put on your website already. I guess any insight into the amount of uptake, and I know it's been a disruptive time in the past few months, but have you been able to engage with organizations of different sizes, and is it mostly unionized, or have you been able to engage other workplaces? Just any commentary on that?
We're really in the early stages. We spent about a year really pulling that website together. It was a really big undertaking, and the rest of our resources, have been going into developing the Healthy Work survey. We do have an outreach and dissemination plan. Obviously, the COVID situation has changed our orientation around that, because we were going to take the survey out to different organizations. We also have collaborations with various labor organizations, CWA, for example, that we're going to pilot test the survey. We collect some data and get feedback from workers about how the process might work for them. But obviously right now we're holding back on that. We're going to get the survey up online and try to push it out in the next 6 months as things, We're also going to add some COVID questions to the survey, I think, which might be really important thing to do right now to orient, folks and how work is being impacted by what's going on right now.
That's great. So what's the timing you're sort of piloting in the next few months, and hope to have the survey tool up by the fall, I think? Was that the...
I think so. I think that sounds like a pretty, that the timetable will be, fall or late fall at this point, depending on what happens here in the fall with, with potentially a second wave of the virus.
Mm-hmm. Yeah, that's something we're all watching and guarded about. There's a comment here from Terry Szymanski, who's worked with us quite actively on Stress Assess and on the COPSUC survey, but she's just commenting that it's a great initiative, and especially that it has tools and resources for different parties like employers, individuals, and unions, and some ideas around intervention and action. So that's great. Applause, I guess.
mean, I think the primary, it really is about pushing forward ideas for primary prevention. I think employers can go to low-hanging fruit, which is oftentimes the focus on, secondary prevention, on looking at, stress management and squeeze balls, and as Peter mentioned, and and they miss the sources of stress in the workplace, of people going back into the same toxic environment, and it's really just a band-aid approach. And I think it's true to do both is important, but especially we're really focusing on how do you do the primary prevention. And unfortunately, we're doing this from a grassroots level, which is fortunate and unfortunate in some ways, but we can work with labor groups and worker organizations to to push out these ideas and implement them, hopefully, as we move further ahead.
Great. Well, and good for you in a challenging time to be pioneering this work. Thanks a lot. And yes, we do look forward to working with you on a bunch of different levels, because stress and workplace stress is a worldwide issue, although I suppose there are some jurisdictions potentially for a bunch of societal as well as work organization factors that are better than elsewhere, for sure. We did actually have John ready to pitch hit if we had time at the end to talk about the Stress Assess and the COPSUC survey and just how it fits in from an international perspective. But I think that we might include his slide deck on the page with this, but I don't think we want to take people's time anymore today, unless there's a clamor of people who want to stay on and see that presentation. I think he's still here. There was one more question. I'm not sure who of you. It's a curious question. So about research on whether flexible work schedules demonstrably help alleviate stress, and it's sort of in the context of the people staying remotely working, I think, or coming back to work, and then some of it around, I guess, the sort of how you organize that work in terms of core hours and that kind of thing. I don't know if anyone's aware of any research in that kind of space.
I've done a little bit of research on this for this work-life balance issue, because we're really interested. Obviously, there's a lot more people telecommuting, and there's been around 24% of the US, according to the Bureau of Labor Statistics, people are working from home even before this, and now it's up to like 56%. And the question is it going to enhance people's health and well-being, being able to have that flexibility to work from home? Or are there other unique stressors, like, for example, which are probably not permanent, having your children at home while you're trying to work, or your spouse at home in the same environment can obviously amplify work-life conflict in many ways, unless you're a single person, which has its own set of stresses, social isolation and so forth. So it would be, I have seen some reviews that suggest telecommuting and having the flexibility to determine your own start times and so forth are positive for health and well-being, but there are the negatives as well. So I think the jury is out.
And I think, John, the worker pandemic experience survey that we've been running, and there's a healthcare one, and in fact, that's a segue, Tony, if you roll up the screen to next week. But I think, John, some of the results have been indicated. People who are working, basically, I think, and maybe that is at home or at work, are less stressed, it seems, than people who aren't. Which is
one of the early findings on the non-healthcare, everybody else worker survey was that people who have been working from home when they don't normally do it were slightly more stressed than people who went to work and were satisfied that the controls that were in place were adequate. So if you're going to work as you normally do and you're satisfied that people are doing their best to prevent infection, you had less stress than working at home without any chance of exposure, which kind of surprised us, but we'll talk about that next week.
It's a teaser. Although, I mean, what comes to mind actually is the phrase we use a lot and is pretty relevant with the COVID situation, which is the social determinants of health. And part of the social determinants is that human interaction piece in the workplace, I think. I mean, obviously there's other more impactful factors potentially on health, but how we replace that social interaction and that sense of team engagement, I think.
Yeah, I think Peter was talking about that earlier too. The fact that once we go back to work, things are going not to be the same.
Well, so Dorothy's making a comment. I guess some are going beyond social determinants of health to corporate or commercial determinants, and she's suggesting she can send some references.